So hello everybody, my name is Jimmy Zhang and I'm presenting a small talk about self-sovereign medical records. This is more about surviving under the US healthcare regime, and you'll see what I'm talking about in a minute. So I've been a software dev in fiat healthcare for 7 years. I've been a sovereign individual for about a year, and I've realized that sovereign is just a euphemism for unemployed/unemployable. But really what I'm doing is working out a pleb lab in Austin, Texas. It's a co-working space for Bitcoiners and Bitcoin ideas run by Car. Shout out to Car. So what's the problem? To steal a slide from a very cool YouTube talk. Well, the problem is that medical care in the United States is too expensive. It recently hit $4 trillion in 2023. It's a 17% increase since 2017. I went through some data and figured out that it's increased by 5,800% since 1971, our favorite benchmark year for measuring when things start to go wrong. So that is the problem. The cost of healthcare is too damn high. Vote for me. Just kidding. But actually, what I've noticed is that Bitcoiners don't really care about healthcare for now. And there's a pretty good reason why, actually, because Bitcoiners, for the most part, are a relatively healthy cohort, but Americans dealing with chronic illnesses and in the throes of American healthcare don't have extra fiat to spend stacking sats. They're stacking health, right? Maslow's hierarchy of needs. But over time, I tried to line these two slides up. The amount of Bitcoiners will grow over time, but there will also be an intersection of Bitcoiners who are going to have serious health issues and therefore experience American healthcare system for the first time. And the very simple explanation for this is that aging is nature's difficulty adjustment, where if you think about it this way, every year it gets X% harder to stay the same level of healthy, where X is a confluence of factors, right? Depending on your lifestyle, your choices, etc. And if you think of yourself as like a system that continuously takes energy, right? You die when the cost to keep you alive approaches infinity. So like we can no longer manage the entropy. And of course it happens sooner under a worse healthcare system. And so what I want you all to know is that there might be 21 million Bitcoin, but there's only one of you. You are, for all intents and purposes, non-fungible. So the thought I was left with is when Bitcoiners interact with US healthcare at scale, what are they going to encounter, right? Well, the first thing they're going to encounter is a bloated administrative system, administrative apparatus. You can see that administrators have grown exponentially since pretty much 1970, 1971. There was a huge uptick in 1990. But the number of doctors has not grown meaningfully, right? You'll find that insurance simply won't pay, okay? So they'll collect the premiums, but they're incentivized to deny you care. And we'll get into that why in a little bit. They'll enact clawbacks against doctors. So doctors will perform a service. They will bill insurance. They think they've pocketed the money, but 3 to 6 months later, the insurance comes back and tries to recoup that money. They're double billing. If you have to be very careful now, so you can't just go to your doctor and ask all of your doctor-related questions, because those things get itemized, and if you aren't careful, they'll just charge you as much as they possibly can. Denying a cancer patient life-saving treatment. I forgot to put the links to this, but I'll update the slides with links so you guys can double check me. But trust me, bro, it is happening. And the denial claims keep on increasing. This is the new way that insurance companies make money now, right? And if you think about it from an incentives perspective, so I think we're all Bitcoiners here, we understand how to think from incentives. The reason why they're doing this is because they're mandated by law to expand coverage, right? So you can no longer operate as an insurance in the traditional sense of the word, right? So just take a step back, think about what insurance is, right? Insurance is a company. They're here to make money. They're trying to evaluate the risk of taking you on as the patient that they want to insure, and they're going to charge you premiums depending on the risk. But they know that in a free market, they can't go outlandishly, right? Because you have choices. But in socialized medicine, they are mandated by law to insure everyone regardless of health outcomes. So everyone is a cost center to them. So if they can't make money by being discerning on the front end, they have to make money by denying treatment on the back end, if that makes sense. And patients get insurance through their employer, so it's relatively not a free market. They're really sticky. And I'm just singling out one example, right? If you dive deep into healthcare, you'll find that there's examples of this problem everywhere. And it really just boils down to who's paying and who's providing the service. It can be really complicated sometimes, especially for just a developer who's just interested in Bitcoin. But I mean, I got sucked into healthcare because Asian parents and whatnot. But you can just map everything to these quadrants and decide for yourself, like, if you're using your own money to pay for yourself, then you're highly discerning about cost and quality. But modern healthcare is on the other end of the spectrum, where you're using other people's money to pay for someone else. No one really knows, and so the costs skyrocket. And for further research, you can follow these guys on Twitter. Each of them have their own special nitpick with healthcare. I think the one banger quote is from Doug McGuff. He's not active on Twitter, but he has a really good YouTube talk where he says the system is designed to facilitate your death as long as all the proper procedures are followed. All right. And like I said before, that's because you're a loss center to everyone involved if you get sick. They just want to get rid of you, right? So for example, if you call your doctor when you're sick, you'll get a voicemail thing that says, if this is an emergency, call 911. But if you try to go to the ER, they'll be like, have you gone to your doctor, right? No one wants you, okay? That's basically the state of American healthcare. And so in this context, what is an EMR, right? So EMR stands for electronic medical records, but what it really is a centralized database of patients and their medical histories, but it's really just it's a billing machine. It's meant to coordinate resources together so that you do have an appointment, right? They're trying to put doctor and patient in the same room, but after that, everything is about maximizing the billing, right? And yeah, this is one of the doctors on Twitter that's reiterating basically a version of what I'm saying here. So EMRs are supposed to be about medical data, but they're not really, right? They're really about recouping costs. And they're the battleground for which the different parties involved are all fighting about who gets to pay, and no one wants to pay. So is there a way to fight back? It's my take that big systems are like final bosses in video games. They are behemoths. They have a lot of HP, but they also have a glaring weakness. I happen to think that there are 3 big glaring weaknesses in American healthcare: medical tourism, sovereign AI, and medical records. So in terms of medical tourism, you can just walk away, right? It's the easiest thing you can do. Walk away, do a flight to Japan or China or Taiwan, get your health taken care of here. In China, they actually give you a booklet if you go to a hospital, because I went to a hospital lately, and they just give you a booklet and they just expect you to self-custody that, which is really cool. You can ask AI. That's the second big weak spot, but AI is not private for now. Like, I used ChatGPT to argue a bill where I was double billed for a procedure, and that was successful, but now Sam Altman has my healthcare data, right? That's kind of the trade-off I made, and it worked, but I'd rather have it more private. And also, the point is, without a good EMR, an AI can't actually extrapolate meaningful data for AI doctors, right? AI doctors are really hot, but all AIs have to have good source data. So that kind of leaves medical records, the one avenue where the patient has some sovereignty. So what I mean by that is, within HIPAA, there's actually, they do acknowledge that the patient has a right to their own medical records. But in practice, they hoard it and make it very hard for you to get your own medical records, because they know that collectively, everyone's medical records in a centralized place is a huge advantage for them. Does that make sense? So we're beginning to see the outlines of what a solution could be, which is, you should be able to self-custody your own medical records if you want, or file them with a custodian that you trust. It's your choice because it's your records, and a good EMR can circumvent existing regulatory structures, because I really don't want to deal with HIPAA, right? And it can connect you directly with a doctor. And so self-sovereign medical records supports both medical tourism, because then you can just go to any doctor in the world, and it supports sovereign AI, where you can ask an AI very personal questions and it won't snitch on you, right? And did I leave a... Yeah, so a little note about systems thinking. Any additional funding into a system is interpreted by that system as it's working, right? So we really want to just walk away completely, like really starve the system of its funding, right? So I'm working on self-sovereign medical records because I believe it ends the corporate practice of medicine, and it restores the doctor-patient relationship. And the big unlock that I had while thinking about this problem, and the big unlock that I want to share with you all today, is that one can think of medical records a lot like Git repositories. So a lot of us interact with Git repos on a daily basis. I want to make a parallel argument that medical records are like Git repos with one branch, right? One commit is representing one medical event, for example, a doctor visit. Each commit is atomic, so you know exactly what happened. It's got a clear ID associated with it. It's got the repo as a whole has clear ownership. It's easily auditable, and sharing your medical record with whichever party you want should be as simple as granting permissions to a private repo on GitHub, right? So this is basically medical history, Git repository, right? It's the longest Git repository you'll ever write to because your medical history ends when you're dead. So no one cares. Okay, cool. So yeah, the idea. So use a subset of Git commands to model patient record keeping is the basic idea. And another note, it's a type of hash chain. So like a commit ID is a hash of the previous commit ID, right? So Bitcoiners should really like that. But unlike Bitcoin, this commit is cheap. It's like free to append to it, right? So that's like the big difference. But it is a type of hash chain. So anyways, so to avoid HIPAA and other nefarious regulations, I had to really step back and think about it like, look, 99% of patients aren't going to run their own Git server for life. Like, that's a huge commitment. So I have to come up with a service where, as a host of medical records, I can provide you a service. But on my end, I have to protect myself, and I'm just storing encrypted blobs, if that makes any sense. So I rid myself of some liability, and I get around some lawfare, some regulations, and I can just argue that, hey, look, these encrypted blobs aren't medical records, they can be anything, right? Only the records plus your private key constitutes a medical record, and that only exists on the client side if you're the patient. So we can't just store the patient's unencrypted private key. We can't have a patient's unencrypted Git repo. So that makes it actually a little bit hard and a little bit different from just a bare Git repo where you have permissioned access by different parties, but the host itself, for example, GitHub, can read all of your private repos. Like, I want to, as a host, not even be able to see it, which kind of implies I have to get into Git itself and kind of overwrite select parts of it, like the Git receive pack, the Git upload pack. This is kind of where I'm currently doing most of the thinking and working. Another thing that breaks is the delta compression. So Git only stores like the diffs, but if you have encrypted blobs, it can be really hard to find the diffs. It must store the full object every time, and also sharing the data with the doctor can be a little bit not as straightforward as sharing a Git repo, unfortunately. On the doctor side, they have to be able to read the data, but have minimum exposure to it over time. So that was an interesting hurdle / problem. But in general, as a whole, a new age EMR in my opinion, is basically an encrypted Git store plus a scheduling service plus Bitcoin payments, right? So I think we can all be on roughly the same page here. So yeah, so what would a doctor visit look like in my idealized version of this service? So to walk through a telehealth version of it, you could make an appointment. You could find a doctor you want, make an appointment with them. The appointment shows up, and you can log in with Nostr, establish a connection, securely exchange pub keys, right? And then through having your doctor's pub key, you can decrypt your Git repo and share it with the doctor securely. The doctor can access it because that repo was encrypted with his or her own pub keys. They can append only notes to the history and send it back to you. And then you'll be doing the git add yourself. In real life case, the doctor, you'll be in a room with a doctor. They have an EMR, but it's relatively lightweight. It just pulls your encrypted repo, and since you're in the room anyways, you can decrypt it in the room, right, on the fly. And we divert 99% of the doctor's attention away from the screen and towards the doctor-patient relationship. And then after that, you just pay in Bitcoin, right? So it offloads the responsibility from the doctor side of keeping records, because when they run a practice, they have this burden that they didn't necessarily sign up for. There's no more data breaches because there's no centralized data repository, and just more time with the patient rather than doing data entry. On the patient side, you can take your medical records with you. You have greater control over your medical privacy, and you can grant and revoke access to whichever party you feel like doing at your discretion. So, summarize, this is kind of like a hand-wavy summary of what's going on here. Encrypted Git repos with client-side decryption. As a medical records host, I never really see any data, so I can't be audited for a breach or anything like that. The user has to keep track of a key pair, which it is cumbersome. I acknowledge that, but we can have different solutions, like on the browser or something. It's hand wavy, but there's different folks working on that, and it's primarily directed towards direct primary care physicians who aren't interacting with insurance and Medicare at all. So for me, next steps would be to onboard a doc in Texas, connect to an e-prescription service like SureScripts, potentially look into grants, things like that. I'll leave you with tips and tricks for interacting with the US medical system. If you're ever just in the US and you're just like in need of seeing a doctor, just don't mention insurance. See what price you get, right? They're mandated by law to give you a price quote if you say you don't have insurance. So just try to say you don't have insurance, see what you get as a quote. Record all your doctor appointments, like secretly record them in audio at the bare minimum. Bring your own medical binder if your case is complex enough, right? There's folks with chronic illnesses. Bringing their own binders to doctor's appointments, and they actually appreciate it. So people are de facto being their own records custodian all the time, and then keep track of all your receipts. All right, good luck. Thanks. This is my Twitter handle. Thank you. Any questions?
Thanks for your talk, Jimmy. I've been thinking about this topic a little bit and find the American healthcare system perplexing. It seems like, though, it may have a lot of opportunities. So one of the other things in the space, though I can see how records is connected to it, might be, like on what you just mentioned, is the doctors actually don't really want the insurance companies there. So is it possible to like just group together a bunch of friends and like you all put some Bitcoin into a pile and then like that's used to pay for medical expenses, like your DIY insurance amongst friends? Could that be a thing that could work? And as a way of opting out?
One could imagine a world where you and a cohort of your friends get together and you can make an assertion to an insurance company and you approach an insurance company and say, hey, look, my friends are relatively healthy. These are the aggregated stats of my cohort, our average BMI, our heart rate, blood pressure, they're all relatively healthy. Therefore, you can negotiate potentially a lower premium. And you can do that potentially with these Git repositories as medical records, right? That's something that's crossed my mind. And there would be a social component of that. I think the more immediate solution that's kind of like what you're saying is crowd health. So if you're not familiar with crowd health, it's started by a Bitcoiner, but they pool resources together to pay for medical events. Yeah.
Like you choose your own group, your own crowd, or it's like
I believe the way crowd health works is everyone's in the same group. Like it's really like GoFundMe for healthcare. So like you're trying to advocate for yourself. You pay a monthly, and they cover a certain dollar amount of medical expenses up to a point. But exceeding that point, you have to kind of raise your funds within their platform. Yeah.
All right, thanks.
Hey, I'm curious, have you looked into self-sovereign identity? It sounds like what you're doing is like under the purview of like the self-sovereign identity mission. Like the encrypted Git repo analogy is something I've heard them use as well.
Yeah, it would be a type of self-sovereign identity. I did mention Nostr. So you can log in to this medical storage service through Nostr and access your records that way.
Yeah, like there's a bunch of research and work into making credentialing protocols of like, like as a medical professional, I would issue a patient a credential and then they could take that with them and present it to somebody else in like a privacy-centric way. So I think there's a lot of work done on this kind of tooling that you might be able to use for free on your project.
Cool, yeah. Let's chat.
Yeah,
for sure.
Yes. All right. So you mentioned in China, they'll give you a book to, they'll give you a little book that kind of like self-custodial or something. Do they just give you like the little red Mao Zedong propaganda book if you're not communist enough, or?
They just give you a booklet. It's in my backpack. I can show it. Yeah.
Cool. Yeah, I was just a little curious about that.
No one, like, it's just a little booklet, and they kind of like print out their take on your medical things right on top of the booklet, and their EMR seems to not really care about you. Yeah.
Thanks.
Thanks, Jimmy.
Cool. Thank you.